So what does this mean? Well, we feel that to sort of sum it up, yes, side effects are problematic, but they're not the main reason why women don't take their medication. What we feel are one of the main reasons is that because maybe they don't completely understand or have had explained completely from a personal perspective what the risk of breast cancer coming back could be if they don't take the medication as prescribed. You know, some of the women said to us, it's prescribed for 5 years, what's the difference is it going to make if I miss a few? Well, that's what the research has shown, it actually does make a difference, but maybe that's not being translated to the people who we're asking to take the medication. Secondly, I think there's definitely a role within the sort of follow-up clinics to look at how the communication happens, because I think both sets of what we heard from clinicians and what we heard from the participants was correct. I'm sure the clinicians do bring it up, but maybe it's not in the sort of context that women feel able to kind of really explore and talk to them about what it means. Maybe they're not sure that the symptoms are linked to their the medication that's been given, and maybe we need to have more time to sort of tease it out and try and understand what women are going through. Now, you may have sort of read or heard that tamoxifen is probably going to be prescribed for 10 years for many of the women who are actually prescribed it currently for 5 years, because the effect has been shown to be even better over 10 years. So if women are waiting for their annual appointment to talk about any problems they're having, I don't think though that's going to go on for 10 years. I can't see how the NHS are going to be able to follow up these women in these annual appointments over 10 years. So we're going to have to look more creatively at where the support for women comes from, and we're looking at sort of the sort of community-based, community and sort of secondary care working together here. So we need to explore options for women to be able to talk about their problems that they may be having, or even to help to identify what their risks versus the benefits are for taking the medication. And this has been found in a number of studies, that women actually look at the sort of the necessity and the concerns that they have about medication and decide whether they're going to take it based on that. So what are we going to do? Well, we're working, and hopefully Pam's coming on board with this again. We're working on pulling together a large study which will try and recruit patients at all phases of their disease, whether it's just newly prescribed medication or 1 or 2, 3 years down the line, and try and look at how we can better support women. There are ways of dealing with some of the side effects, things like cognitive behavioural therapy, relaxation therapy are found to be very beneficial. Maybe we need to look at more ways of kind of getting that out there for women. But I think generally what we find from this study is that if we support women, if we provide the information that allows them to weigh up the risks, to guess the benefits, more women will actually continue to take the medication and receive the full benefits of it. I just want to kind of end with one quote which I think sums up what the women in our study really experienced. I'm going to have to take my specs off, sorry, I can't see. So, you have to change your whole lifestyle, and you know, I'm not getting the violin out, I'm still here, I'm alive, you know. So that's the other side of it, where you're looking and saying, well, thank God that I went, thank God they found it, and thank God I'm still here. I'm still alive, but there's huge consequences that I live with every day. It makes it really difficult. And you know, if you were to ask me, would I still go on tamoxifen? Absolutely, because I wouldn't risk breast cancer coming back. And I think that's generally the message that the women gave us from this study. Thank you.